I work at a pharmacy in Copenhagen, and last month, an American man came in holding his shoulder. He asked where the emergency room was. I pointed him to the hospital 2 blocks away. He asked how much the visit would cost. I told him it's free if he has his EHIC card, or around 200 kroner without it. That's about $30. He laughed. Actually laughed. Then he said, "No, seriously, how much?" I repeated the price. If you already knew this, or you want to be the kind of person who does, you're in the right corner of YouTube. I decode cross-cultural logic every week. Subscribe so you don't keep getting blindsided by the world. He stared at me like I'd told him the moon was made of cheese. That's impossible. Emergency rooms cost like $2,000 minimum. I know because I went once in Florida for a sprained ankle. I explained that Denmark has universal health care. He said that's socialist propaganda, and he'd seen documentaries about how Europeans wait 6 months for broken bones. I told him the ER was right now, no appointment needed. He asked if they accepted Blue Cross Blue Shield. I said they accept the Danish healthcare system. He asked if they took American money because dollars are worth more anyway. He left, came back 20 minutes later with his arm in a sling, and asked where he should send the bill. The nurse told him there was no bill. He insisted someone must get paid. She said yes, through taxes. He said he doesn't pay Danish taxes, so surely he owed something. She said just the 200 kroner facility fee. He pulled out his phone to check if this was a scam. When a prescription costs less than lunch, Americans think Europe is broken. Last week, a woman asked if our ibuprofen was the real kind because it cost $2. She bought 6 boxes and said she was saving hundreds compared to Walgreens. It was the exact same medication. Another guy tried to use his FSA card at a German pharmacy. When it didn't work, he asked if Europe does HSAs instead. The pharmacist said Europe does public health care. He asked which insurance companies participate. All of them. Through the government. He said that sounded communist and bought paracetamol with cash, muttering about freedom. And that was just Tuesday. I'm a pharmacist in Amsterdam, and an American woman handed me a prescription from her Florida doctor. It was for Lipitor, 90 pills. I told her it would be 18 euros. She said, "No, what's the copay?" I repeated, 18 euros total. She said her copay in America is $50, so something's definitely wrong. I explained that's the actual price here. She said medication can't be that cheap because her insurance pays $300 for the same prescription. She demanded to see the medication to verify it wasn't counterfeit. I showed her the box. She Googled fake Lipitor Europe on her phone right there at the counter. She found an article about counterfeit drugs in Southeast Asia and said, "See? I knew it." I pointed out the article was about Thailand, not the Netherlands. She said all foreign countries are risky. She asked if we had FDA-approved versions. I explained European medications are approved by the EMA, which is equally rigorous. She said she'd never heard of the EMA, so it couldn't be legitimate. She wanted to call her American pharmacy to compare pills. I told her to go ahead. She stepped outside, came back 10 minutes later, and said Walgreens confirmed the pills look identical. She asked if I could charge her the American price, because otherwise her insurance wouldn't reimburse her. I said I cannot charge 70 times the actual cost. This level of real-world absurdity doesn't trend. It hides in everyday interactions most people miss. I surface them weekly. Hit subscribe and step into the version of YouTube that actually explains human behavior. She said it felt illegal to pay so little. She bought them, but looked suspicious the whole time. I checked later. The markup on prescription drugs in America is roughly 300% compared to European prices. She paid correctly. She just couldn't accept it. Working at a pharmacy in Prague, an American man asked for Ambien. I told him we have Zolpidem, which is the same drug. He said no. He specifically needs Ambien because his doctor prescribed that brand. I explained Ambien is Zolpidem. The brand name is just marketing. He said if brands don't matter, why do they exist? I said profit. He asked if Czech pharmacies are required to give patients generic versions to save the government money. I said we give patients medication that works, regardless of branding. He said in America, you can request name brands if you don't trust generics. I told him European generics are chemically identical. He said American drugs are higher quality because of capitalism. He pulled up his prescription bottle on his phone and showed me it said Ambien Zolpidem. I pointed at the parentheses. He said, that's just the scientific name. I said, no, that's the actual drug. The word before the parentheses is the marketing. He asked to speak to whoever's in charge of the pharmacy. I was in charge of the pharmacy. He asked if Charles University, where I studied, is a real medical school. I showed him my diploma. He asked why it was in Czech. I said, because we're in the Czech Republic. He said medical degrees should be in English for safety. He left without buying anything, came back an hour later and asked if we had European Ambien. We gave him Zolpidem. He took it. Slept fine. I work at a clinic in Oslo, and an American woman came in for a persistent cough. The doctor prescribed antibiotics. She asked how much the prescription would cost. The doctor said about 50 kroner at the pharmacy. That's $4. She asked if he meant $4 per pill. He said no, for the full course. She asked if Norwegian antibiotics are weaker than American ones. He said they're the same antibiotics. She said in America, antibiotics cost $80 even with insurance, so there must be a difference in quality. He explained that pharmaceutical companies charge Americans more because they can. She said that's conspiracy theory talk. She asked if the prescription included a prior authorization form for her insurance. He said Norwegian prescriptions don't work like that. She said American insurance requires doctors to justify prescriptions. He said he just prescribed it. That's the justification. She asked where the 14-page insurance form was. He said there isn't one. She wanted to know if she needed to get it pre-approved by her insurance company. He said she should just go to the pharmacy and buy it. She asked what happens if her insurance denies the claim. He said Norway doesn't have claim denials for prescriptions. She said that's impossible because someone has to verify medical necessity. The doctor, very patiently, explained that he verified medical necessity by prescribing it. She left confused, came back the next day and said she called her American insurance and they won't cover foreign prescriptions. The antibiotics still only cost $4. She paid it, but said the system felt broken. I'm a receptionist at a private clinic in Barcelona, and an American man called asking if we accept United Healthcare. I said we accept payment and can provide receipts for insurance reimbursement. He said, that's not how insurance works. You either accept it or you don't. I explained that Spanish private clinics work on a pay-first model. He said that's a scam. He asked how much a general consultation costs. I said 60 euros. He went silent. Then he said, 60 euros for what? Just to talk to a doctor. I said yes. He said in America, that's $200 minimum, and that's with insurance. I said yes, things cost less here. He said American healthcare is the best in the world, so the prices must reflect quality. He asked if our doctors went to medical school. I said yes, Spanish medical schools. He asked if those are accredited internationally. I said Spain is in the European Union and has some of the best healthcare outcomes globally. He said he's never heard of Spanish doctors. I said that's fine. They've heard of medicine. He booked an appointment, came in, and immediately asked the doctor where he studied. The doctor said, University of Barcelona. The American asked what that ranked globally. The doctor said he doesn't know and doesn't care because he treats patients successfully. The American asked if Spanish medical licenses are valid. The doctor pointed at his framed license on the wall. After the consultation, the American asked for an itemized bill for insurance purposes. I gave him one. He looked confused. He said in America, bills have dozens of line items with codes. I said ours just says, consultation, 60 euros. He said his insurance needs procedure codes. I said we don't do that here. He asked for a super bill. I asked what that was. He explained it's a detailed receipt with diagnostic codes. I said we could write "patient consulted for back pain" on the receipt. He said that's not enough documentation. I said it's what we have. He left frustrated, muttering about how European healthcare lacks transparency. Working at a hospital in Berlin, an American woman asked where she pays her copay before seeing the doctor. I told her there's no copay. She said there's always a copay. I said not in Germany if you have insurance. She said she has Aetna. I explained that doesn't apply here, but if she has travel insurance or European coverage, most costs are covered. She said she needs to see her in-network provider list. I explained German hospitals don't have networks. You just go to the hospital. She said that violates her insurance contract. I said her American insurance contract doesn't govern German hospitals. She asked how she's supposed to know if this hospital is quality if it's not in her network. I said we're a university hospital with excellent ratings. She asked to see the hospital's star rating. I said we don't use star ratings. She pulled up Google reviews. We had 4.2 stars. She said that's unacceptable and she needs a 5-star hospital. I told her hospital quality isn't measured by Google reviews in Germany. She said in America, you can look up hospital rankings. I said you can here too, through medical publications. She asked if we accept her prescription drug coverage. I said pharmacies handle that separately. She asked where the in-hospital pharmacy is. I said we don't have one for outpatients. She seemed amazed that healthcare could function without every service under one corporate roof. She asked how much the ER visit would cost if she's uninsured. I said a few €100 depending on treatment. She said that's impossible because her last ER visit in Texas was $11,000 for stitches. I said American healthcare costs are inflated. She said they're inflated because the quality is superior. She saw the doctor, got treated, paid €80, left confused. I work at a pharmacy in Stockholm, and an American man brought in a prescription from a Swedish doctor for blood pressure medication. He asked if we could bill his insurance directly. I said no, you pay here and file for reimbursement. He said that's inconvenient. I said it's how European pharmacies work. He asked why Europe is so behind on technology. The medication cost €12. He said that can't be right. His American prescription costs $150. I said yes, medication is cheaper here. He said the pills must be smaller or lower dosage. I showed him the box. Same dosage. He said, maybe they're extended release in America. I said they're identical. He asked if Swedish medications are bioequivalent to American ones. I said yes. He said he'd heard that European countries cut corners on drug testing. I said that's completely false. European drug approval is equally rigorous. He said if that were true, Americans wouldn't pay more. He asked if I could write a letter confirming the medication is legitimate, so his doctor doesn't think he's buying drugs on the black market. I said this is a licensed pharmacy, not the black market. He said he just wants documentation. I printed a receipt showing the pharmacy name, medication, and price. He looked at it and said, "This seems fake." I asked why. He said, "Because it's too simple. American pharmacy receipts are full of insurance codes and explanations of benefits." I said, "We don't need that here." He bought the medication, but took a photo of my pharmacy license, just in case. I'm a doctor in Lisbon, and last month an American woman came in for a minor infection. I prescribed antibiotics and told her to rest. She asked when I'd be sending the prescription to her pharmacy. I said she takes the paper prescription to any pharmacy. She looked horrified. She said, "You're giving me a paper prescription? What year is this?" I explained that paper prescriptions are standard in Portugal. She said America switched to electronic prescriptions years ago for safety and efficiency. I said paperwork's fine. She said, "What if she loses it?" I said, "I'll print another one." She said, "That's a HIPAA violation." I said HIPAA is American law and doesn't apply in Portugal. She asked if Portuguese pharmacies can verify prescriptions are legitimate if they're just on paper. I said yes, we've been doing it for decades. She said it seems like a system ripe for fraud. I said fraud is extremely rare because pharmacies verify doctor signatures and stamps. She asked where the security features are. I pointed at my official stamp. She took a photo of the prescription and said she'd have her American doctor verify it's real. I told her to go ahead. She asked if I could email her a copy for her records. I said she's holding the record. She asked what happens if the pharmacy doesn't accept it. I said they will because that's how prescriptions work here. She went to the pharmacy. They filled it immediately. She came back to my office an hour later and asked why the system works if it seems so outdated. I told her that sometimes simplicity is more effective than complexity. She said American healthcare is advanced because it's complicated. I said American healthcare is expensive because it's complicated. She paid 40 euros for the consultation and 8 euros for the medication. She said she'd spent less on healthcare in Portugal in one day than she spends monthly on insurance premiums in America. I told her that's the point of universal healthcare. She left looking thoughtful. The funniest part? She left a review saying Portuguese healthcare is surprisingly functional despite being low-tech. We've had universal healthcare since 1979. It's not surprising. It's just not American. Americans don't realize their healthcare system is the exception, not the rule. When medication costs less than coffee and doctor visits don't require a second mortgage, they assume something's broken. They've been told European healthcare is slow, outdated, and dangerous. Then they experience it and discover it's just affordable. And somewhere right now, another American is explaining to a Norwegian pharmacist that generic drugs can't possibly work as well as brand names because capitalism requires expensive things to be better. I track these moments so you don't have to. The cultural blind spots, the ego clashes, the quiet comedy of confidence meeting reality. Subscribe now if you'd rather understand the world than just laugh at it.